So Katie, can you tell me what at work is causing you to have these feelings and these emotions?
Well, when I initially took this job, I've been director for about 6 months. When I initially took the job, I felt real included and very welcome by the other managers. All the managers in our facility are male, except for the OB director. That's the only other female. And like I say, for the first couple of months, I felt like I was included. And then I just started noticing changes. We would have leadership meetings, or we'd have financial meetings, and I would try to make recommendations or ask questions, and basically was just ignored. Here a few weeks back, our hospital's in a real financial crunch, and we were having a meeting, and I made the suggestion that what if we had the aides just work 8-hour shifts and come in the most busy 8 hours of the 12-hour shift, and that way each of them could work an extra shift a week, and we wouldn't have to hire more staff. And basically was ignored. And a few days later, one of the other directors made the same recommendation, one of the men, and he got all this praise and was they were very receptive to the idea, but yet I said the exact same thing and was totally looked over. I've really prided myself through the years of being proactive and being a leader, and it's really been a blow to my self-esteem, feeling like I can't be as an effective leader as I want to be.
So is it hurting your performance or your interaction with your staff or anything like that?
I actually get along with my staff very well. We have a couple of male nurses on the unit. I get great feedback. They're happy with some changes that I've made to try to make their work more streamlined. So I don't have any issue on that end. But just knowing that anything I try to do in my management position that has to include other managers, I feel ineffective, and it's really has made me feel depressed, and I think about it a lot at home, not feeling like I'm doing a good job.
So it's carrying over in your home life, you say?
Well, probably more so just not enjoying things like I would, because in the back of my mind I'm worrying about my job performance, my perception of the perception of whether they think I'm a good manager or not. But I would say the last few weeks, it's almost like I've thought, I'm just going to do the bare minimum, because it doesn't matter if I excel at it, it's not going to make any difference. So why beat myself up trying to do a better job when it will go unnoticed and unappreciated? So in the way of me being motivated to do a better job, yes, it is affecting my job performance.
What about the safety of the patients?
Not really. I do take patient care shifts from time to time. As a manager, I'm not required to, but if someone calls in sick, or if we have a high patient census, I will take care of patients. And in that area, I don't let it bother me. I feel like I provide the same type of patient care. It's more in my managerial role.
So is there anybody in upper management that would back you up and stand behind you if you address it?
Well, I thought there was. probably about the third or fourth week when I first started noticing issues, I went to talk to the director of nursing. And he seemed very sympathetic and said that, you know, he would be looking for, paying attention to see if there was any disparagement in the way we were treated. And, you know, I felt really good about that. I thought, you know, I've got somebody on my side that's going to be just trying to see if there's some changes that need to be made. That didn't come to pass. We had a management meeting and I had made a suggestion, made a couple of suggestions, and basically the director of nursing didn't support me on that and fell in line with those other managers, making me feel like my ideas weren't pertinent.
And what about the other female manager? What?
In general topics and you know, just general things in nursing, they treat her the same way. The difference is within her department, since it's OB, they kind of give her a little bit of, you know, it's not an area that they're familiar in and don't even want to be familiar in. So she kind of gets out of being completely put aside just simply because her department, she's the authority in her department, and they aren't really familiar with that type of nursing.
So the men are more involved in your area?
I have critical care, so all of them probably at some time have worked in that type of an environment. So
even the
they feel
CEO
like,
or whoever's.
well, the director of nursing, yes, he's worked critical care before. Now our CEO's he's never provided patient care.
Has he been in these meetings as well?
And
see the
he's
same
been in a few of the leadership
reaction?
meetings, but he doesn't go out of his way to include me and the other female nurse within the decision-making process. They pretty much run over us and make their own decisions.
How about organizations, or maybe is there some kind of union or anything that
Well,
can help you out in that area?
in Texas, we're not allowed to have a union, but there's American Nursing Association. I haven't really addressed the problem with them. My feelings would be is they really probably don't get a lot of that kind of complaint, since nursing is such a predominantly female profession. But I definitely would be open to looking into seeing if they have any resources for me.
That'd be one of my suggestions. What about maybe changing jobs or locations, or just getting away from
You're talking about a different facility?
different facility?
Well, I kind of have a selfish reason for not pursuing that. Anything else would be at least an hour drive, whereas where I'm at now is about 30 minutes from my home, and I already struggle coming home after a 12-hour shift or after a long day in my office. Just getting home is a real safety issue, so I really kind of scares me to think about adding another hour of drive time to my day.
So
that
that's
takes another hour away from my family too.
So that's pretty much out.
For now, you know, if it were to get to a point where it was just totally unbearable at work,
Okay.
I would have to look into something. Now, whether, you know, I might have to go and do a different type of nursing, home health, whatever. I really enjoy critical care, and like I say, I love my staff, and we have a great rapport. But
Okay. So it appears that you can't at this point change facilities, locations, to get away from that. They're not going to change evidently. You can't
There's no
change it.
catalyst for change. I mean, they can run all over, run over us, and apparently the director of nursing is just as, has the same feelings that
Okay.
as men, it's their place to make the decisions.
Okay. So maybe one of the options that we have right now is to do some type of coping to change your emotions, your feelings. In order to do that, we have to change some, maybe some changing from negative thoughts to more positive thoughts. And we can use some techniques like mindfulness skills, or which would help you to get in the process of, looking at the situation as it is, and moving to where you're not reacting but acting on within, where you're not reacting to the situation, but you're acting from yourself, and you're not letting that, you're not reacting to them, you're not letting it affect you as much. So changing the way you look at it, because of, you're kind of in a stuck position in a way, because until you can't bear it any longer, that's the only way you would look at another facility. We've already established they're not going to change, so evidently things are not going to change there. So maybe just being more assertive, not letting it get you down. I mean, these are the ultimate goals, but it's getting learning coping skills to deal with it. So work on those techniques. We'll start on that on our next session. Give you some homework to take home with you and look at, some things to read, be self-reflection type things, check boxes and stuff like that, yes, no answers, and there'll be some elaboration type answers too, short answer.
Will any of those help me decide if it's is a perception thing, or if it's a true, in my mind I'm thinking, am I blowing this out of proportion? So will those exercises help me determine?
They can. The mindfulness can. You could use some, maybe set up some ways to, when you're dealing with your director or the other managers, to kind of test to see, kind of like what you were saying. You said that you had gave one suggestion first, and then it was kind of blown off, and then a few days later the same suggestion is given by a man, and then it's put in place, I guess, and he gets praise and glory.
He gets the credit for.
And I don't know if he heard you say it or not, but
Oh, I'm sure he did.
so. But maybe, if you want to be sure of it yourself, is to maybe set that up again in some other ways, some other settings again, and see if you get the same reaction. That way you can be sure of it, and know whether it's a perception or whether it's an actual
And and my husband
situation
has asked me that a few times. He said, is it just, you think it's just in your perception of what's going on? And
I
I
can't
really
answer
honestly
that.
I don't feel like it is, just simply because I'm also seeing it with the other nurse. It's not like I'm,
So have you talked to her about it?
no, I haven't.
Okay, well, you need to,
I hate,
I
I
shouldn't
hate
say you
to,
need to, but I would suggest that if you feel comfortable talking to her, and
I just hate, if she's not feeling it and she's not being, I hate to throw up a flag when she may not
just
even be.
ask her how she feels in the meetings or something like that.
Yeah, keep it generic.
Mhm. How do you think that meeting went?
Did you feel included?
Yeah, there you go.
That's a lot of it. I feel like I'm just not even included.
Okay. Well, that's a good way to do it. So, like I say, just to help pick up your, hopefully, and help change your emotions and your feelings about this, we can work on some skills.
Well, I could do my job and do it well without their approval. But, like I say, I have prided myself on being a good leader and doing an effective job on every level. And this has really knocked me down.
Let's work on skills and techniques to help you relax, and if you're having any anxiety with it, then it'll help calm you with that. And if it can get you to teach you how to calm yourself and relax, and then mindfulness skills of learning how, there's radical acceptance, there's a whole host of detailed techniques within mindfulness, and it's all about accepting the moment as it is in the present time, not past, not future, but accepting it as it is, as it's happening.
Not letting your previous experiences
Right.
change the way the present
And then
experience
you
is.
use techniques within that to be able to focus and see the details and learn how to change those situations so that you feel more in control of not only your feelings, but what's going on around you.
Be nice.
Okay. Well, we'll start that. Like I said, before you leave here, we'll get you some homework sheets to take with you, make some copies, and we'll get back together in the next session and go over it.
Okay.
Move from there.
That sounds good.
Okay.